about rural and remote country health is that you're servicing a hospital as a pharmacist, you're serving your patients there, but they're all from your community. So you don't have an enormous catchment of people that could be coming from anywhere. They come from your region, your community, your area, and that's what I like about it.
Regional pharmacy is so varied. If you asked all of us what our day involved, every single pharmacist would give you a different answer because we're all doing different things at any day.
We need to make sure that we're compliant with the conditions on the poisons permit, and also to provide clinical support to the nurses. So the nurses might have questions about medication management or medication safety, or how to apply policies to real life scenarios.
So there's hospitals, and then there's nursing posts, and then there's remote Aboriginal communities, and all of them would have a different level of stock that they hold, so it's making sure they have the right impress stock, and it's a lot of contact with the nursing and providing backup to the nurses. So to be able to be on the ground and chat face to face with somebody, you can cover a lot of ground and be really helpful to somebody in those positions. There's a lot of travel involved and you get to see so much of the area, so that certainly takes you out of the office, and it's really interesting to get out to those sites. Last week I went to Kalbarri, and so we were able to have a little quick pull over at the Kalbarri Cliffs. We looked out and there's dolphins there, and this is beautiful, and there's a kangaroo, and so it's just so magical that on my day-to-day work I'm able to go out and see things like that. I really love it.
Working in a regional site like Geraldton means that you're given more opportunities to do things you might not be exposed to in a tertiary hospital. So we're all generalists, so everybody gets to do a bit of everything and is supported to grow outside whatever your experience set is when you come to us.
There are over 25 recognised specialties for hospital pharmacists, and in a metro setting you might only encounter 1, 2 or 3 of them in any clinical area. In country WA, sometimes you'll encounter all of them each day on a medical ward or a specialist ward, wherever it might be. So there's a lot more opportunity.
As an intern out here, you get a lot more responsibility and a lot more accountability, and you can have more of a lasting effect, not only on the pharmacy department but also on the hospital and even the community.
You're at a smaller site, you get to know everyone really well, so you know your whole team, but then also you get to know the nurse managers, you get to know the heads of department.
The smaller town means that there's 30,000 people in Geraldton, so you're more likely to come across the same patients on a semi-regular basis. And that's part of the satisfying part of clinical pharmacy, is that you're getting to see, did what you do have an effect on that person? If you've got a lot more people in your population set, then you might not see them as often, and sometimes you don't know what happened and you don't get the satisfaction of closing the loop.
It's not just the clinical knowledge that I feel like I was exposed to a lot, but it was also the supply knowledge and like the governance knowledge, and taking on roles that naturally an intern or a young pharmacist wouldn't dream of for another 5 to 10 years, and I've kind of been doing them now.
The access to continuing education has been amazing through WACS. It's really, I think is one of the best opportunities that people get, is all the education you get provided here.
Something we're really fortunate to have right across country WA is our specialist pharmacist network. So we have WACS-wide specialist pharmacists in areas such as palliative care, mental health, cancer services, etc., medicines information. And so our pharmacists who are out in the regions are not only supported by their colleagues in that local hospital, but also specialist pharmacists that are working right across WACS. So they've got a network of people they can plug into. So that's an acknowledgement that you can't have anything in a country hospital, and we want to support our pharmacists to grow in their areas of expertise or interest, or whatever their patients require.
There's lots of opportunities to start at the entry-level pharmacist position and to be supported through to more senior positions, and potentially at a faster rate than that might happen, in a metropolitan site. I've progressed from the entry-level pharmacist with support up to 2 more senior roles to end up in the regional chief pharmacist. as strong. We were looking for a medium-sized town next to the coast so that our kids could grow up somewhere where they've got lots of freedom and beach and they can get muddy and dirty and paddocks and things, so, which is what we've certainly found, yeah. The pharmacy hours are really family friendly, so the pharmacy's open 8 till 4 Monday to Friday with some Saturdays 8 till 4, so you can take your kids to after school sports and still get there. We try and be as flexible as we can around things like school assemblies and bits and pieces. There's no on-call in evenings for most of the team.
For me, one of the big selling points about moving and living rurally is the commute. I just love that it's 10 minutes to the beach and it's 10 minutes to the shops and it's 10 minutes to my house.
You learn how to, get amongst it with community activities like sports or, I don't know, whatever there is to do. So yeah, it's great. Do it. You won't regret it.
Whether you're from a community pharmacy background or a hospital pharmacy background, I would give it a go.
I don't want to sound too cliche, but I'd say just go for it. I can't imagine not doing it now with the opportunities that I've gotten here and what I've experienced outside of here. For anyone else that was in my position, I would say just go for it. Just do it.